Okay. Good afternoon, Professor Arango. My name is Alan Lamazares, and this is my LMIC 3 final presentation. I'll be comparing the country that I chose for my LMIC, which is Ghana, compared to my home country or country of origin, which is the United States of America. Okay, we're going to start off with our global health rule. And first off, my global health role, I'll be representing myself as I'm going to be playing the role of a public health officer for the United States of America Air Force. We continue. Now let's start off with a brief country overview. Let's start off with Ghana. Has a population around 34 million with an expectancy of around 65 and a half years. The leading health concerns in Ghana are hypertension, diabetes, cardiovascular disease, stroke, and infectious diseases, to name a few. There's rising non-communicable diseases that are taking place in Ghana, which is a burden to urbanization through diet shifts, pollution, and low physical activity. And there is a CHPS system, which is a community-based health planning and services system, which is providing community level care with limited specialist ability for citizens around the area. Now let's take a look at the United States of America. They have a population of about 340 million with a life expectancy of about 79 years. The leading health concerns are heart disease, cancer, diabetes, and obesity. They have a well-developed hospital network and advanced medical technologies. Although to get those treatment, it usually is high cost, or you need to be dependent on insurance, or you need to pay out of hand through the the capitalism way that the United States functions. So let's continue with healthcare quality, starting with Ghana. So the quality definitely varies between urban and rural regions since rural regions don't have as much resources and are hard to get to. It's much difficult for health centers and emergency vehicles to get to those regions quick. There are limited specialists throughout all all types of specialists in Ghana are very limited since the lack of funding and the lack of resources they have. Many simple diagnostics tools like the CT scan and MRI and just simple lab work are only available in the major cities like Accra and Kumasi. Chronic disease management, such as hypertension and diabetes, are inconsistent due to sometimes being medication shortages. Sometimes they have it, sometimes they don't, as well as irregular follow-ups, a wide range, limited amount of physicians with a wide range of citizens needing help is very inconsistent and very difficult to get sometimes a simple checkup. And like I said before, emergency response time is often delayed, obviously because a lot of places are rural in Ghana, as well as there's not that many limited trauma centers. So even if everything was close and urban together, because of the limited trauma centers, it would be very difficult to still reach patients. Now, looking at the United States, there's a broad variety of specialists and subspecialists around the United States. There's a high standard diagnostic technology that's available. You can get any type of test, any diagnostic, whenever, wherever you want. Obviously, it's going to be a little pricey, but the United States pretty much has everything. The emergency response time has been well developed with trauma centers and EMS systems at every corner in the entire nation. And we have a very high quality standard of care, but there are disparities based on income, region, and insurance. Some rural regions may not have as much, as well as some insurances, because these are citizen managed companies. They don't cover certain things. And, as we know, the richer you are, the better treatment and care you get. As well as if you're someone poor, you're going to very struggle with health because everything is money dependent in the United States. Now, going to the next is healthcare costs. Let's compare healthcare costs, starting with Ghana once again. The NHIS, or the National Health Insurance Scheme, provides partial coverage for Ghana citizens, many of these services still require to go to that out of pocket for that other half that is not covered. The essential medicines that we all need in our daily lives are sometimes unavailable because of lack of money and lack of funding. That sometimes they have it, sometimes they don't, and patients and citizens will need to go out and get it privately or under the counter. The per capita health expenditure is around 85 to $100 a year for Ghana citizens. Some cost barriers for the country lead to delayed diagnosis and poor chronic disease management, leading to more unhealthy citizens. And the SSB tax of 2023 introduced the supporting of non-communicable diseases to prevent them. But the funding has been very inconsistent, so there hasn't been many growth in seeing a change as the rise of non-communicable diseases in Ghana continues to prevail. Now look at the United States. The per capita health expenditure is over $12,000 a year, which is the highest globally. And I'm sure we all know how expensive it is to get health care. There are there are insurance-based systems that are either through your job, through government, or through private. They're all very expensive, and I'm sure we all know that as well. Prescription drug costs are significantly higher than other income nations, although the United States, especially this year, has done a tremendous job reducing the price of drug costs. I believe it's down 200% or so. Uh, But still, drug costs are still exceptionally high, probably one of the most in the world. And high costs contribute to the medical debt and the delayed treatment. And overall, just the national debt that the US has contributes to these high costs, as we are always constantly needing to borrow more and more money. Okay. So let's continue. Let's compare the health systems organized the how the health systems both work in the United States and Ghana, their structure. So let's start off with Ghana. They have a mix of both a public and private health system that are anchored and overlooked by the Ministry of Health and the Ghana Health Service. They have a tiered system, which is starts off with community health posts, then go to district hospitals and regional and teaching hospitals, which is regional and teaching hospitals are the ones in the major urban cities, and the community health posts are the small ones that you may see in rural areas. The NHIS also aims to unify and cover as many citizens as possible, but you have to remember, as we talked in the last slide, only partial. So that may be 50, 75, whatever it is, but they never cover full 100% for their citizens. And lastly, they have a very strong emphasis on primary care and community health workers, trying to get as many as possible to get into the medical field and help out because they have so many limited specialists, limited nurse, limited doctors. So they want to get as many people in as possible. Now look at the United States. They have a very structured and organized system that includes the federal, state, and private entities. As you know, there's a lot of federal and state hospitals that are a lot cheaper, but then you have the private hospitals that tend to be the upend ones to give the best care. But that's not to side the fact that the federal and state ones are also great hospitals as well. There's also a mix of private insurance, Medicare, Medicaid, VA Health. VA Health is obviously related to Army veterans, and Medicare, Medicaid, and all those types are sometimes um are sometimes I'm blanking here. Are sometimes are I'm sorry, are government insurance that you get through the government, and then you also have a mix of private insurance companies, companies that go out there and offer their services privately. Now, looking at health delivery can vary dramatically by state and insurance. A lot of insurance cover a lot of different things, and based on the state, some states have more access to more things than others based off of population in that state, density in that state, things like that. and insurance type as well. Just like I said, some insurances cover more than others, so it also varies on that standpoint. And there is a very strong emphasis on specialty care and advanced treatment, which there's plenty of in the United States of America. Going on, oh my goodness. Okay, now let's look at something new. We looked at healthcare accessibility and cost. We looked at how the health structure is in both countries. We got a little country overview. Now let's look at the citizens, the population. How are the citizens health-wise doing? Ghana, the median age is 21. That means there's a very young population compared to global averages, which Ghana is doing very, very well. The infant mortality rate is 29 out of 1,000 births. Maternal mortality is 308 out of 100,000, which is good numbers. The major lifestyle risks in Ghana are high salt intake, refined carbohydrate diets, limited fruit and vegetable intakes based on the location and geography, rising alcohol consumption, and growing urban inactivity. And some of the infectious diseases like malaria are still common, but the major disease in Ghana are non-communicable diseases, which is now amounts to about 43% of all deaths in Ghana. Now going to the United States. I'm sorry, I didn't even realize this was up. But now looking at the United States, the median age is 39 years, which is an older and aging population in the United States. The leading causes of deaths are heart disease, cancer, stroke, and chronic lung disease. The main, as you see, the main diseases in the United States are all heart related, and that is because of obesity and diet and lifestyle in the United States. So a lot of these companies, we use a lot of preservatives in our food and a lot of junk in our food that causes obesity, causes like high sodium intake, and it's just poor for the heart in general. That's why most of the disease in the United States are heart related. Now, the infant mortality rate is 5.4 out of 1,000 births, and the maternal mortality rate is 20 per 100,000 births. And the higher prevalence lifestyle, which is obesity, is 42% in the United States, which is pretty high and intense number, as well as diabetes being 11% and hypertension being 47%. Now, I can't really see what this. Okay, now let's look at how each country is addressing its health challenges. Once again, let's start off with the United States this time. They have an expansion of telehealth services, increasing access to rural and underserved populations. So now they know that in the major areas, health is doing well there. They want to go and access to the rural population. They're the federal government is making tons of investments toward reducing maternal mortality and improving cardiovascular health outcomes. There's enhanced data systems and electronic health records being built for prevention of chronic disease management and energy preparedness, and also just being organized, making sure, you know, um every patient is accounted for and we all the documents are organized. Now, the nationwide public health efforts addressing obesity, smoking, vaping, and mental crisis, those are the main issues right now in the United States, and the United States is actively working to reduce those issues. And there's major medical research and pharmaceutical innovation that is working on advanced treatment options for major diseases that have not been solved yet and do not have a cure, such as cancer, ALS, Alzheimer's. And there's many diseases still out there that don't have cures, and the United States is working avidly through innovation and research to find a cure. Now, looking at Ghana, they plan to expand the CHPS to increase rural access for basic care and health education, getting more access and more focus on those rural areas. They want to implement something called a HUPEN protocol, which will standardize hypertension and diabetes treatment at a primary care level and get it better. They want to introduce something called a SSB tax, which is the sugar sweetened beverage tax, which was introduced in 2023, which will reduce sugar intake in Ghana and generate revenue for non-communicable disease prevention as well. Although funding has been very low and very slow, as I mentioned before. There's also strengthening of something called a DHIMS2, which is National Health Data System, allowing for more accurate reporting to log everything that's going on with their patients and be more organized and logging everything. There's also an increasing of training of nurses, midwives, and community health workers to get some of that lack of professionals in that industry to get more of those with early detection and management of these chronic diseases. And there's also continued campaigns against malaria, HIV, and tuberculosis that are some of the major diseases in Ghana that they're working on preventing as well. So Ghana is overall attacking their problems head on, and they're doing a great job at it. You know, okay, now as a U.S. public health officer, now that I introduced to you both Ghana and the United States, looked at both a lower income country and a higher income country and compared them. As a professional, I'm going to give some suggestions for Ghana, as in the assignment sheet, it shows that I'm taking on this role and I'm going on a mission trip over there. So I want to continue to work on the CHPS and communities and do a community strengthening phase. I want to expand basic screening on, blood pressure, glucose in those community health rural areas, and just work on basic screening, basic things to understand what these citizens do basic diagnosis and things like that. I want to get more professionals and get more tests done in those rural areas where we don't know much about how those citizens are. Just going into the other bullet point, improve rural health education on non-communicable diseases. In those rural areas, education is very lacking. I want to get all the kids and maybe some of the adults there educated on what non-communicable diseases are and how to prevent them, as that's the major thing in preventing a disease, is knowing what it is and knowing what not to do. I also want to support training of the first response teams and get more professionals, as Donna is already doing, but I want to enhance on that. Train new nurses and midwives and things like that. Going to the enhancement phase, I want to strengthen supply chains for essential medication. Sometimes, as we mentioned, the medication shipments are sometimes they have it, sometimes they don't. And that's probably because of lack of accessibility to ship sometimes. Sometimes it's probably difficult because of health. I'm sorry, not of health, because of weather and other complications. So I want to strengthen the supply chain to make it more consistent, to consistently get those shipments of medication coming in. I want to improve data reporting and digital health tracking. In the age of technology and the age of AI, if we start bringing them more computers and teach them how to work with technology, we can probably log patients better and have a organization of all the patients in Ghana more simpler and easy to access. And I want to expand the ongoing training for Ghanaian clinicians. As I just said, in the strengthening phase, I want to continue to train. The main part is there's a lack of professionals. Without a lack of professionals, there's not much that can be done. You need people working, you need people monitoring to see improvements. So we just need to put an emphasis out there to get people to join this industry, be interested in helping people in health, and train them, educate them, and teach them what to do. The more people we have, the better the country's going to get health-wise. And lastly, implementation and partnership. I want to develop joint emergency response protocols, support low-cost prevention campaigns, such as, teaching people about how to diet better for your health, less alcohol, teach them the negative the negative effects of alcohol, and establish a U.S.-Ghana clinical exchange program where from times where, Ghana may be lacking on professionals and medication and just the health industry in general in Ghana doing poor, I want to build a connection that the US can come and help. I know the US comes and helps and sends, military or health professionals or all types of things to different countries to help them out. I want to become an ally and bring the United States over. So at times of need, they could send shipments of medication, shipments of technology to do standard diagnosis like a CT scan or an MRI scan, or even bring in professionals for time being and have professionals train other people. That is huge. Now, um, hold on. Okay, so now I have some data statistic charts for you guys, just briefly to look over, as this is a chart comparison head to head based off of Ghana and the United States, based off of birth rate, mortality, I'm sorry, not mortality rate, maternity rate, diseases such as cancer deaths, deaths in general. And Ghana, for being a lower income country, is doing pretty well. They're ranked somewhat similar to United States. Looking at the first one, birth rate, they are two times more than United States, which is impressive for how little funding and money Ghana has compared to the United States. And birth and maternity rate, average age of mother at childbirth, they're ranked eighth in the world, 5% more than the United States. Looking at another one, birth and maternity, the fourth one there, they're ranked 54th, and United States is ranked 33rd. They're not off by much. Same thing with deaths. Deaths, they have a little over 25, and United States is at 100. Same thing, diseases, cancer. They're all very similar, if you could see. So I look at this and I interpret this as Ghana is doing very, very well for the limited funding, the limited everything with health that they have. I'm very, very impressed with how Ghana is doing. Now to the next chart. This is another chart, basically just more of a general thing on healthcare, comparing the United States and Ghana. As you can see, 9.2% of the US population, or 30 million people, do not have health insurance, and 40% of people in Ghana have health insurance. There's healthcare affordability on both sides, healthcare deserts, workforce shortage. Everything else is the same. So I think both of these two charts show that Ghana, with such little funding, with being polar opposites, that the United States has so much technology, so much resource, so many people, and Ghana has a complete polar opposite with so little of all those aspects. They are still ranking very close in statistics health-wise to Ghana. And that's what I talk about in the conclusion with a brief thing. In comparing Ghana and the United States, we see two different health systems shaped by different resources and priority. Ghana shows strong process and maternal trends in community health and system development, while the US maintained broad access and advanced medical care. These insights help us understand how to collaborate effectively and support Ghana's ongoing health improvements during deployment. And with that being said, here's a bibliography. And with that being said, thank you for listening to this presentation. I hope you learned something, and I hope you learned as much as I did, because I genuinely enjoyed doing these last three LMICs. It was mind-boggling to me how impressive Ghana is and how great they're doing with such limited resources. So thank you, and have a great rest of your day.